AM 1220 KHTS HometownStation.com. I am T. I'm normally with you Monday through Friday, your afternoon tea during the drive time. But today, I'm actually a little excited because I get to be here for the Providence Holy Cross Hour. And with me is Dr. Alon Antebi. Hello, sir, and how are you?
I'm doing great. Thank you.
Tell me a little bit about your education, your background, what your field is, what you're working in now. Give me a little bit of info on you.
Sure. I'm an orthopedic surgeon. I did my orthopedic training in Michigan at a hospital called Botsford Hospital. I went to medical school in South Florida. It's an osteopathic school where I did 4 years of medical school. And after that, I did a 5-year orthopedic residency. And then after that 5 years, I did another year of fellowship, which is called a trauma fellowship. Trauma fellowships allow me to help patients that are in severe accidents. And with that, a lot of different types of surgeries that we do. One of the other specialties that I specialize is in orthopedic joint reconstruction, doing hip, knee, and shoulder replacements as well.
Now, for the most part, there are a few reasons that lead people to have an actual replacement. But what are some of the things they could do that are a little more conservative? If someone is experiencing pain and they think to themselves, I think a number of people have a tendency to go to the dark side. Oh, no, I have hip pain. I have these issues. Am I a candidate? And before we talk about what makes them a candidate, what are some of the things if someone is experiencing, before they come to see you, what are some of the more conservative things they could do to help with that pain?
Sure. So not everybody that comes to my office is a surgical candidate. Most patients actually get conservative treatment. So some of the symptoms that somebody would have with, like, for example, knee pain or hip pain is swelling of the joint. They would have achiness of the joint. Sometimes getting out of bed in the morning, the first few steps of that joint, whether it's a knee, hip, or shoulder, is a little stiff. And as the day progresses, they're kind of doing okay, a little achiness. But then when they get home at night and that joint is resting, it starts to ache even more. And sometimes they can have pain at night as well. So some of the things that we offer patients are arthritis medications. Those medications have their own problems. People who have diabetes, high blood pressure, heart problems, a lot of times cannot take those medications. So then we offer them injections. Injections can include medications such as a steroid. So it goes directly into the knee, or the hip, nothing that they would have to take orally. Other injections include medications called hyaluronic acids, which is different companies make those types of injections. Usually it's a series of 3, sometimes it's a 1 injection, depending on the medication used. And now the other thing that we offer in our office is stem cell, meaning platelet-rich plasma protein. This is basically a procedure that you come to the office, we take some of your blood, a certain amount, and then we spin it in a centrifuge and combine it with some other medicine and then inject that into the joint.
Which still sounds very Star Trek to me. Every time I read about it. Now, let me ask you a question. And the average bear would come in, maybe age-related aches and pains, maybe an athlete. Were you by chance an athlete? What got you interested in being in orthopedics?
Sure. So when one goes to medical school, usually they have no idea what they want to do. They know they want to be a doctor.
What made you want to be a doctor? Did you have a mentor, or was there?
Right. So when I was in high school, I did have a knee injury, and I went to see an orthopedic surgeon who I was just enamored by. He was just unbelievable, just the clout that this gentleman had.
And how old were you when you went to him?
I was about 16.
So this was someone that you looked up to, you knew he was going to help you feel better, but there was something about him that maybe triggered that. Had you thought about being a doctor before that moment?
I always knew I wanted to get into the medical field when I was younger. I just didn't know I wanted to be a surgeon.
Did you have relatives who were in the medical?
No, neither of my parents went to medical school. My parents my mom graduated high school, that's it. My dad did not. I have 2 siblings that are not in medicine. I have no family in medicine at all.
So somewhere along the way, you developed this sort of fascination with maybe the science or
exactly
the people?
Right.
And
exactly right.
That was something you were...
Exactly right. So, medicine is not, when I graduated high school and then started college, most of my friends were already, doing their job and everything else. And I entered medical school. I was, making, peanuts to basically train to be a doctor. And it was very, very difficult, a long road.
What was your sport? What was your injury?
I played football. And I had
And that's pretty well known, is that those boys come off that field.
A lot of soccer, a lot of knee injuries. I mean, in my practice today, that's a major part of my practice. I see a lot of sports-related injuries.
Now,
yes.
was the injury that led you to the doctor something that you thought was, as a student athlete, career-ending? Was it that? What led you
No,
to see a
thankfully, I did
doctor?
not need surgery for it. It was mostly a sprain in the knee, but it did not require surgery, thankfully.
But was there that great fear when the pain happened?
Absolutely. You come in, you don't know what's going on. You're a lay person. You have no idea what's going on. You're like, am I going to need surgery? Is this, is this going to hurt? Is it going to be painful? What's going to happen to me? So
I'm sorry that you had the injury, but for your patient's sake, I'm sort of glad because you understand the fear that they come to you with.
Absolutely. So there's a lot of anxiety. I do a lot of injections. People come into the office. They're like, oh my gosh, I'm so scared. And I literally they need an anxiety pill, but I try to ease them. I let them know that this is not going to be painful and, try to take care of them.
All right, when we come back from the break, we're going to talk a little more with Dr. Antebi, who's here as part of the Providence Holy Cross Hour, orthopedic surgeon with a wonderful background. We're going to talk a little bit more about what patients who might be experiencing some pain and some fear at the moment, what they can do before they prepare to go to the doctors, what they might be looking at. Again, this is AM 1220 KHTS, hometownstation.com. AM 1220 KHTS, hometownstation.com. I am T, normally with you Monday through Friday, your afternoon drive time 3 to 7, but today I get the lucky privilege of being here for the Providence Holy Cross Hour, and today I am with Dr. Antebi, who's a board-certified orthopedic trauma surgeon, and we're talking a little bit about hip replacements, where someone's having joint pain, hip, knee, and what comes from that. And Dr. Antebi, we talked about what it is when someone comes to you with pain and sort of conservative treatment. What if someone comes in and like right off the board, like you're talking about, like a young athlete, and I know there are a few different reasons people have joint pain. Sometimes it's arthritis, and we talked a little bit about arthritis medicine. Sometimes it's something to do with the bones. Is it osteonecrosis, where things are causing problems with the body? If someone comes to you, first-time patient, walks in the door, maybe an athlete first, a younger person, and says, I'm just having these debilitating pains, what's the first thing they can expect when they come to your office?
So the first thing, they'll meet my friendly staff in the front.
I was just going to say staff first.
Right? And then they'll be taken back into an examination room. Most likely they'll get an x-ray of that joint. If they've already had an x-ray at another facility, we'll try to locate that. But sometimes with the orthopedic surgeons, we're very particular with the view. So if the x-ray wasn't done optimally, we'll repeat the x-ray in the office for me to look at. And a lot of times, if there was no fracture, or if the patient didn't go to the ER and they were told they have a fracture, a lot of times that could be just a soft tissue injury. And at that point, depending on the exam, the findings, how long they've been having pain, their symptoms may require an MRI. That is basically a painless exam where they go into a facility, they have a 30-minute exam done, and then they would come back to the office to go over the results and figure out exactly what is wrong with their knee.
So not days in between. I know sometimes you'll go in. So for the most part, you like to do things where the patient will come in and you're looking at the MRI that day too?
No, not that. Well, they would have to go get the MRI done
first,
and then they would come back and see me. Exactly right. After they get the MRI, we have the results. I would be able to look at the films, and then we can go exactly as to what is wrong with them and what needs to be done. Sometimes it's surgical if they have like a meniscus tear or a torn ACL. Sometimes it's operative, sometimes it's not. Sometimes it could just be a knee sprain where it's not operative, and just some more time, some physical therapy, rehabilitation, anti-inflammatory medications will just do the job.
Who are the best patients for that kind of procedure? I mean, I know if there's a pre-existing condition, sometimes it makes your job a little tougher. You want someone who comes in who's basically the good diet. I mean, are there optimum conditions for it? Of course,
yeah. Somebody obviously overall healthy, somebody who's fairly active, not necessarily large or obese, are the preferred patients. But, we see patients of all walks of life, young, old, big, fat, skinny. We see it all. And we have to kind of curtail the treatment plan as to what their lifestyle is like. I mean, if somebody just twisted their knee because they were coming down some steps and had an ACL tear, they're not necessarily going to need an ACL reconstruction if they're just walking every day, not necessarily active or exercising. But if it's somebody who is an avid softball player, racquetball player, soccer player, those people are going to want to have reconstructive surgery because they want to preserve the longevity of their knee.
Now, if you have a patient that comes to you, for example, who's having joint pain, do you also look at their lifestyle to say, I'm always curious, is it something because some people will come in and say, I have pain, that old joke, doctor, it hurts when I do this. Well, then don't do that.
Sure.
So the patient who comes in and maybe it's something that's part of their lifestyle, what they do for a living, or if they, like I sit too much and
Sure.
I'm finding at my advanced age, I'm starting to notice some creaks and pains. And if someone comes to you, is that one of the first things you look at and you
Yes,
say, well,
I ask people all the time, what do you do for work? Do you have any hobbies? What do you do on the weekends? Are you a weekend warrior? Is this something that you do all the time? Absolutely. So, arthritis doesn't just pop up one day. Arthritis is actually something that develops over years of either prior injury or wear and tear. You're a football player. You work construction your whole life, and then all of a sudden you're 45 and like your knee hurts every day. So that knee pain or that problem in the knee didn't happen when you were 45.
So
it started when you were like in your 20s doing construction. It may not have hurt you at the time, but now it's getting to the point where it's bothering you every day. And some things we can fix. Some things we cannot fix. I mean, there's those people that we call in-betweeners. In other words, they're not ready for that knee replacement, but they're still in pain, and they're kind of either too young, too active to get a knee replacement. So we have to do other things to preserve their natural knee for as long as possible. Medications, injections, the bracing, arthroscopies, little minimally invasive procedures, or other things that we can do to try to preserve their knee.
Now, going back to the doctor who treated you when you were a teenager, do you remember what was it? Were there things that were different about how he approached your injuries to what is happening now, or have things sort of stayed the same as far as the criteria for issues?
Yeah, I mean, most of the stuff is pretty much the same. I mean, obviously, no doctor in their right mind is going to give a 16-year-old, a knee replacement. But it's, we still have the technology of MRI. Some of the MRI sequencing has gotten a little better in regards to, examination. We can figure out a lot of stuff. But somebody comes in with an acute injury. Sometimes it's hard for us to examine the knee because they're in pain. We have to maneuver the knee a certain way. So a lot of times we can just tell the knee's swollen. They may have blood in their knee from the recent twisting injury playing soccer. So at that point, we know that there's something cooking in there. And we need to get an MRI to figure out, because there's no fracture on the x-ray. So we know there's something going on. We get the MRI and it gives us all the information that we need.
I'm curious, when your patient comes in and they've sustained this injury, and what's one of the first things you say to alleviate their fear that they may or may not be a candidate for something more serious? Is there a conversation you have with them to prepare them for that?
A lot of it depends on on their injury. I mean, I see some patients where it's like it's where they come in with a specific type of fracture or some kind of injury. They're going to need surgery. There's no way to get around it. But most of the time we try to, ease their anxiety, ease their fears about, they're going to find, in today's society, everybody wants to get better tomorrow, right? They want to be active tomorrow. But some injuries are life-altering. They're life-altering injuries, especially when I take care of somebody going 60 miles an hour, falling off of a motorcycle and has a horrible injury to their leg or their hip or whatever it is. Their life, they're never going to be the same again. Our job is to restore their function as best as possible, but that does not happen overnight.
That's all right. Well, when we come back, we'll talk a little bit about like a base. I don't know anything about sports, but we're going to use like a baseball analogy. I'm going to ask your stats about your surgeries. Coming up, we're talking with Dr. Antebi here for the Providence Holy Cross Hour on your hometown station, AM 1220 KHTS.